Recently, you shared an article where you had a health scare with a contraceptive pill. So I did what I do best and I sent you a message and go, hey, my beautiful friend, are you okay? But I also called my sister, who is a healthcare professional. And I said, hey, my beautiful friend, she had this challenge. And I went, oh, my sister's a healthcare professional. She's like, yeah. That is an unfortunate side effect. It's printed on the side of the box. And I'm going, who's reading the side of the box?
Thank you.
Who's reading the side of the box? Who knows anything? But also I get a lot from healthcare professionals like my sister and others who will tell me, what medication are you taking? Do you know what's in them? Do you know the name of it? No, I don't. I just trusted my doctor who gave me some medication, who I'm assuming when the card finishes, I am better. Tell me about your experience, and we'll delve a little into what it taught you.
So I was diagnosed with, I hope I'm saying this correctly, pulmonary emboli, which is, in a nutshell, clots in your lungs. And it all happened on a Tuesday night last October. I'd felt in the lead up quite sore, and I love to run. I tried to go for a run a few times in the days leading up and really struggled to even make it a kilometre and found myself out of breath. And I also suffer from asthma. I have since I was a kid, and I was having trouble breathing, and I thought, oh, it's probably just my asthma. And you kind of gaslight yourself a little bit thinking, oh, it's not that serious, And I think as Australians, we often it'll be right, it'll be fun. It'll sort itself out. And you hope it sorts itself out. But I called my mum on my lunch break. I went out for a quick walk. There was something I had to check in with her about, and I was walking. And on previous lunch breaks, every now and again, I've had enough time where I've been able to go for a run. And she said to me on the phone, she said, oh, Sammy, darling, are you running? I said, no, I'm literally leisurely stroll. And she's like, your breathing sounds really haggard and you're really struggling. She said, has your asthma flared up? And I said, oh, I don't know. It hasn't flared up for a while. I think I'm okay. And she said, Sammy, are you sure? And I mentioned to her the chest pains, and it had felt like I'd done a really big HIIT workout. And I've never been into strength training. I should do more. I know I should do more, but I love cardio. I love to run. I love to go for a walk. I like getting outside. And it was like I was stiff all across my chest, my back as well, my lower back. Basically, hindsight's a beautiful thing, but where your lungs are, this area. And I remember sitting at my desk in the Canberra office, and I'd breathe in and it would hurt, and it started to hurt when I would breathe. And I gave myself to the end of the day 5:30 clock off. So if it's still happening and I'm having trouble breathing, I'll just take myself to the hospital. So I went into emergency. The nurses were brilliant. And I even said when I got to the desk, I said, look, I don't know if I'm overthinking this. So I do suffer from asthma, but I'm having trouble breathing. They got me into triage straight away, and then they took me straight through to the emergency department and admitted me. And one of the nurses knew straight away. She had an inkling. So what pill are you on? So I was on the Yasmin pill, had been for about 6 or 7 years, and you shouldn't be on that one for more than 18 months to 2 years. And she said, and she had a beautiful Irish accent. She was so lovely. And she said, I think it's one of 3 things. She said, you might be pregnant, you might have pneumonia, or she said, I think this is the more likely one. I think you might have clots in your lungs. And she was like, I don't mean to shock you, but we've had so many young women your age. She said young millennials. So I'm 31, kind of in that 28 to 35 age group who have come in. And because the Yasmin pill, for anyone that is listening who is a young woman or is a woman around my age, the Yasmin pill was the one you wanted because it helped your skin, so it dried out your skin. And I suffered with acne on and off throughout my whole life, and that's the one I was put on to kind of help cure that. That's kind of like now that I think about it, it's a bit of a Band-Aid. But when I did get the official diagnosis that night, I was in shock, and I was in shock at first, and then the days following I was really angry. because I eat well. I take care of my weight. I try to have veggies, fruit every day. I exercise every day without fail. Like, it's not necessarily always intense exercise like a run, but I always go for a walk. I've got a little dog. And he gets his steps in too. We do together. And I was angry that this had happened to me. I was like, I do everything. You know, I check which vitamins I should be having and make sure that even in terms of my my female health, like that all my bits and bobs are working properly and have regular checkups there just to make sure that everything's in check. But yeah, I was really, really angry. And unfortunately, if I had had a health professional like your sister, I don't think that would have happened. I think because we do get so busy, often I would just book into a doctor to get a script renewed. And I think we all do this, you know, whether it was with my asthma puffer, my Ventolin, or it was with the contraceptive pill or whatever. And I would just book in. And the last few times, and I can say hand on heart, I wasn't asked how long I'd been on that pill for. And granted, I take full responsibility. I should have read the box. And that's on me, you know, my culpa. But like you said, who's reading the box or the fine print? And I got really upset last week or the week before whenever they announced the new pharmaceutical benefits scheme, the next round that we're going to be put on that. I don't fully know how it works, so I apologize if I've got some of this wrong, but they do put a contraceptive pill on that so that it's more accessible for young women or anyone who needs to go on the pill. And the Yasmin pill is the one that's now on that. And that's so concerning. And unfortunately, I think it's going to have to take something drastic because there are so many of us after sharing my story. And I was in two minds about sharing my story. It's personal and it was a very emotional time. I wasn't sure if I would be able to have kids. It means moving down the road, my health, there is ramifications for me in perimenopause, menopause, moving into old age. There is a number of medications that my mum has taken through that process of menopause that will be off limits for me because it will mean that I will clot. If I am ever lucky enough to have a child of my own and be pregnant, there is ramifications for me there. I'll need to be really careful. I'll need to take certain injections every day, which I will happily take if it means that I will get to have a baby and start a family of my own. But yeah, it was just a lot. And there was lots of other common stories that was so similar to mine that came out of the woodwork. Again, sounds like the Carol podcast, but my mum would told lots of people in the cafe, and so many people reached out, even just in Goulburn. And through my social media in Canberra, nationally, I had a few international messages of friends that, you know, had moved to London or were over in the States, and they were like, oh my gosh, I'm on this pill and I haven't had to check it. And I've been feeling like this. And when I say feeling like this, I think I should go back to the beginning and when I was diagnosed. In the months leading up to that, I was so lethargic. And I think I don't sound arrogant in saying that I am a go-getter. I'm very active. Sure, I need to hibernate and be a vegetable for a couple of hours on the weekend, but I'm always on my feet, and that's when I'm at my best. And I remember saying to my sisters on the phone, I was like, I don't know what's wrong with me. I didn't know if it was maybe I was depressed or I felt tired all the time. I could not have enough sleep. And I've done breakfast radio, so I know that I don't need as much sleep as everybody, you know, thinks you do. I know my limits. It was quite a tumultuous time.
That's wonderful perspective that tells all of us that sometimes we need to take the time to understand ourselves, but understand what we are taking. A lot of the time, I think blind trust has its limits and extent.
Yeah.
And I don't think it's a new problem. I think it's just a human problem or a problem of convenience that we have decided that the money we've invested in said professional, whoever they may be, is valuable. But I think our lives are more valuable.
Agree.
So I think there is a point in time that we need to reset. We need to say, okay, what am I taking? Why am I taking it? But also find people like you who have the courage to share, because while you have shared and you've been through what you've been through and you've got to still work through a few things, you've also enlightened that challenge to a lot of other people who may not know otherwise. So thank you for being bold. Thank you for sharing.